Hello, my name is Valerie Martin, and this is my presentation on degenerative disc disease for medical terminology. In this PowerPoint presentation on degenerative disc disease, also known as DDD, we will be discussing the definition of DDD, the prevalent symptoms of DDD, how a person is typically diagnosed with DDD. We will also look at some of the possible treatments for DDD, and we will also discuss the medical resources a person would utilize when navigating this disease and its painful attributions. The definition of DDD is the gradual decay of one or more of the intervertebral disc in our fibrocartilaginous joints of our spine. Our intervertebral discs are composed of three parts: the nucleus pulposus, annulus fibrosus, and the cartilage end plates. The nucleus pulposus contains water and a gel-like fluid of greater viscosity. The annulus fibrosus, being of tougher composition, surrounds the nucleus pulposus. Whenever there is a tear in the annulus fibrosus, the fluids of the nucleus pulposus are able to leak out of the structural foundation of the disc becomes compromised. The disc loses height and then bulges. At this point, it has become a prolapse of an intervertebral disc. The disc then compresses the nerves that surround it, and the patient begins to feel the pain and pressure. When this occurs more than once or the site of the occurrence does not improve after treatment, the diagnosis of DDD is given. While some patients may be symptomatic, most patients have some sort of physical pain attributed to DDD. Severity of pain ranges from case to case, but these are some of the commonly discussed symptoms. Pain that affects the lower back, buttocks, and thighs. Pain in the neck that may radiate to the arms and hands. Pain that is worse when sitting. Pain that gets worse when bending, lifting, or twisting. Pain that lessens when walking and moving. Pain that lessens with changing positions often or lying down. Periods of severe pain that come and go, lasting from a few days to a few months. Numbness and tingling in the extremities. Diagnosis of DDD and confirmation of diagnosis is typically easy. Unlike some diseases and conditions, it presents itself in telltale signs and red flags. The first step would be a primary care physician with complaints of a lower back pain. The physician will review family medical history as well as a visual examination of the way the patient sits, stands, and the gait of their walk. The physician will also test range of motion and strength. If this is the second or third trip to the primary care physician, he or she will refer the patient to an orthopedic doctor. The orthopedic doctor will want imaging that the primary care physician may not have ordered, so the patient will need to get at least an X-ray, MRI, or both. The orthopedic needs to be able to see both the bone structure and images of the soft tissue or around or in between the bones. After that, there may be need for even more specific imagery, and a CT scan may be employed. For patients that cannot enter the machinery for the MRI or CT imagery, let's say due to a medical implant or pacemaker, a myelogram will be utilized. Treatment options for DDD vary and are dependent on the severity of the pain the patient experiences. Treatments can range from non-surgical, such as ice and heat, stretching, physical therapy, and maybe even non-traditional avenues like yoga and acupuncture. If the patient fails to respond to those options, then non-invasive procedures become the next step. These may include epidural steroid injections, medial branch blocks, or radiofrequency ablation. If failure to respond positively to these treatments, surgical options will become the last resort. Three of the most widely used surgical procedures are spinal fusions, discectomy, and artificial disc replacement, also known as ADR. Something worth noting is that there is new research being conducted and released that shows spinal fusions are not the, quote, best option. While it was believed that ADRs would replace spinal fusions, the full verdict is still out. But it is safe to say that ADRs haven't fulfilled the initial hopes of something to replace spinal fusions. Resources that a patient may employ would include the primary care physician, physical therapist, diagnostic imaging specialist, an orthopedic, and probably a neurosurgeon. They will visit imaging centers, rehabilitation centers, and surgery centers in their endeavors for a pain-free life. In conclusion, Those affected by DDD have a tough and sometimes uncertain path to wellness. Their symptoms may progress or remain the same. It may stay contained to one joint or possibly expand to more. Diagnosis is the easy part. Navigating the endless possibilities of treatment seems to be completely different and complex at times. The two best resources for someone affected are medical insurance and the watchful eye of a well-advising primary care physician.